If you're over 60, there's something you do every single night that could quietly raise your risk of a stroke, without pain, without warning, and without a single clue. As a brain doctor, I've seen it countless times. Healthy patients struck down overnight simply because of the way they sleep. Most people think strokes happen during stressful moments, but for seniors, the real danger often comes in silence, during sleep. Here's the hidden truth. After age 60, your brain becomes more vulnerable at night. Blood vessels lose flexibility, blood thickens, and your blood pressure fluctuates dangerously in the early morning hours. In fact, 60% of strokes occur during sleep or right after waking. And the shocking part? Your sleeping position can make it all worse. A bent neck can twist your arteries. Lying too flat can trap blood inside your head. While you dream, your brain could be quietly fighting for oxygen until one night, it loses. Today, I'll reveal the 11 sleeping positions and nighttime habits that are secretly raising your risk. Stay with me because one of these, a position millions find comfortable, may actually be restricting blood flow to your brain by more than 40%. This video could protect your memory, your independence, and perhaps even your life. Let's begin.
1. Sleeping flat on your back, no pillow, supine, head level. For decades, sleeping flat on your back was considered harmless, even ideal. Lying flat, arms at your sides, no pillow beneath your head. Many older adults do it every night, often because it helps with back pain or breathing. But physiologically, it's one of the riskiest positions after 60. When you lie completely flat, your head rests on the same level as your heart. In younger bodies, flexible veins and arteries easily manage that balance. But in aging vessels, blood no longer drains from the brain as efficiently. Instead of flowing smoothly down the jugular veins, it pools, especially during the early morning hours when blood pressure naturally surges. When blood sits stagnant, oxygen levels drop, pressure builds inside the skull, and even a minor clot can cause sudden confusion or weakness by morning. It's silent, it's mechanical, and it's preventable. The safest adjustment is small but powerful. Elevate your head about 20 to 30 degrees. A wedge pillow or 2 supportive pillows under the shoulders can help gravity assist blood flow instead of fight it. Studies from Critical Care Explorations 2021 show that even slight head elevation, around 30 degrees, improves oxygen delivery and reduces intracranial pressure without harming sleep quality. But when you lie completely flat, especially if you're dehydrated, blood flow can stagnate. Overnight, small clots can form in narrowed arteries, and when morning blood pressure rises, they're pushed straight to the brain. That's what happened to Leonard, a 77-year-old Navy veteran who slept flat every night. One morning, his wife found him half awake but unable to speak. Doctors found a clot in his left middle cerebral artery, a stroke linked to poor venous drainage during sleep. The fix is simple. Raise your head 20 to 30 degrees. A wedge pillow or 2 supportive pillows allow gravity to help your brain, not fight it.
2. Sleeping face down, prone position. It's the position millions find comforting. Face down, cheek on the pillow. Some say it helps their back. Others say it eases snoring. But as a brain doctor, I need to tell you something most physicians never mention. Sleeping face down may be one of the most dangerous positions for your brain. Here's what happens. When you sleep on your stomach, your neck has to turn sharply to one side so you can breathe. That twist compresses the vertebral arteries, the vessels that carry oxygen-rich blood through your spine to the back of your brain, the region that controls balance, coordination, and consciousness. According to Sleep Medicine 2019, Circulation 2018, and World Neurosurgery 2024, this neck rotation can significantly reduce blood flow by up to 20 to 40%. Combine that with age-related dehydration or mild sleep apnea, and you have the perfect setup for an overnight stroke. If you or someone you love sleeps this way, change it. Try resting on your side with your neck in a neutral position or slightly elevated on a firm pillow that keeps your head and spine aligned. A contoured pillow can prevent twisting and keep your airway open.
Sleeping under a heavy blanket, head covered. It's a habit many older adults find comforting, pulling the blanket up over the head at night to block noise, to stay warm, or to feel cocooned and safe. But covering your head at night traps more than heat. It traps carbon dioxide and reduces oxygen intake. This small bedtime habit can quietly turn dangerous, especially after 60. When you cover your head with a heavy blanket, you're not just blocking light or sound, you're trapping the air you exhale. Over the course of the night, oxygen levels under the blanket drop, while carbon dioxide slowly builds up around your nose and mouth. In older adults, where oxygen regulation is weaker and arteries are less flexible, that mild nighttime hypoxia can thicken blood and trigger unstable blood pressure changes that set the stage for a stroke. Medical studies show that even mild nocturnal hypoxia, oxygen saturation falling below 92%, significantly increases stroke and dementia risk. The American Heart Association 2023 warns that low nighttime oxygen is one of the strongest predictors of both ischemic and hemorrhagic strokes in older adults. When you rebreathe stale air under the blanket, oxygen levels drop, heart rate rises, and blood pressure fluctuates. Add overnight dehydration, and blood becomes more viscous, thicker, making it easier for tiny clots to form in narrowed vessels. You go to sleep feeling warm and safe, but by morning, your brain may have spent hours struggling for oxygen. The fix is simple. Never sleep with your head fully covered. Keep your bedroom warm enough to feel comfortable, but let air circulate freely. If light or sound bothers you, use a sleep mask or earplugs instead of pulling the covers over your face. Your brain depends on every breath you take, even while you sleep.
4. Sleeping upright in a recliner. For many older adults, sleep doesn't happen in a bed anymore. It happens in a recliner, the same chair used for reading, watching TV, or easing back pain. Some older adults do this to ease hip pain or acid reflux. But prolonged recliner sleeping may quietly reduce circulation to the brain. It can quietly increase your risk of stroke, especially after 60. When you sleep in a semi-upright position, your torso is angled at 45 to 60 degrees. Gravity pulls blood downward. Blood tends to pool in the lower body, while the veins that return blood to the heart and brain work harder. Over time, that sluggish return flow can lead to venous stasis, blood moving too slowly, thickening slightly, and forming small clots. Research in Hypertension 2021 shows that older adults experience blood pressure instability when sleeping semi-upright. The brain's baroreceptor reflex weakens, leading to unpredictable surges or drops in pressure. In a 2018 circulation study, researchers found that prolonged upright rest in older adults reduced cerebral blood flow by nearly 15%, particularly in those with vascular stiffness or mild heart failure. It's not only the pulling that's dangerous. Sitting upright weakens the baroreflex, the body's natural system that balances blood pressure when we change positions. During deep sleep, that reflex becomes less responsive. The result? Blood pressure instability, dipping too low, then surging too high, one of the most common triggers for early morning strokes. Add dehydration or compression from swollen legs, and the danger rises further. The fix is, if you must sleep elevated for back pain or reflux, use a wedge or adjustable bed that lifts your upper body while keeping your hips and legs supported horizontally. This prevents pooling and maintains even circulation. Before bed, stretch your calves and rotate your ankles to help blood flow upward. It may seem like a small adjustment, but positioning your body to rest, not recline, helps your brain wake up strong and steady, not starve for oxygen.
Number 5, sleeping on the right side with arm under pillow. It's one of the most common sleeping positions in older adults. Lying on the right side, arm tucked under the pillow, head turned slightly down. It feels natural, supportive, and familiar. But this position quietly compresses some of the most important blood vessels supplying your brain. When you lie on your right side with your arm under your head, the weight of your body presses directly on the carotid artery and subclavian artery, two major vessels responsible for sending oxygen-rich blood to the brain. At the same time, the brachial plexus, a bundle of nerves that runs from the neck through the shoulder, becomes pinched under the body's weight. That pressure doesn't just cause numbness in the arm, it can also interfere with blood flow to the head and neck. According to Surgical Neurology International 2024 and Sleep Medicine 2019, prolonged neck bending or shoulder compression during sleep can reduce blood flow in the vertebral and carotid arteries by up to 30 to 40%. For someone in their 70s, whose vessels are already narrowed and less elastic, that restriction can cause blood to slow, pool, and thicken. If a clot forms during the night, the first sign may come too late: a numb hand, slurred speech, or one side of the face that won't move. The fix is simple. Never sleep with your arm wedged beneath your pillow or head. Side sleeping is fine. Left side may relieve nighttime reflux. Rest your arms slightly forward or alongside your body, not underneath. Use a contoured pillow or ergonomic pillow that supports the natural curve of your neck and keeps your spine straight. Sleeping on your left side may also improve circulation for the heart and brain, according to studies published in the American Journal of Cardiology. Comfort shouldn't come at the cost of circulation. Let your pillow support you, not your arm. Your brain will thank you every morning. 6. Tossing and turning all night. It's something many older adults accept as just aging. Waking up multiple times a night, shifting positions, flipping the pillow, never quite settling. But constant tossing and turning isn't just a sign of poor rest. It's a warning from your brain. Each time you move sharply in bed, your blood pressure and heart rate rise for a few seconds. For younger adults, that's harmless. But in older adults where arteries are stiff and vessel walls fragile, these small spikes and drops create turbulence in blood flow, microsurges that can stress the vessels supplying your brain. A study from Hypertension 2021 found that seniors who experience fragmented sleep is linked with higher BP variability and inflammatory vascular stress, two ingredients of the early morning stroke pattern. Another paper in the Journal of the American Heart Association 2020 linked poor sleep continuity with increased inflammation and impaired vascular repair, a combination that raises the risk of clot formation during the night. When sleep is repeatedly interrupted, your body loses the deep recovery stages where blood pressure naturally stabilizes and the brain clears metabolic waste. Instead of healing, your vessels spend the night in a constant state of stress. That's why many strokes happen between 2 a.m. and 6 a.m., the hours when poor quality sleep and unstable circulation collide. The fix: treat restlessness as a medical symptom, not a normal part of aging. Avoid caffeine and alcohol after dinner. Keep your room cool and dark, but use light, breathable bedding so you don't overheat and shift all night. If you or your partner notice frequent movements, gasping, or snoring, talk to your doctor about a sleep study. Restless sleep isn't harmless.
It's your brain asking for help before the damage is done.
7. Skipping blood pressure or heart medication at night. Maybe you fell asleep early, got distracted, or told yourself it's just one night. But for adults over 60, forgetting or skipping your evening blood pressure or heart medication can be far more dangerous than you realize. Your blood pressure follows a natural rhythm. It lowers slightly while you sleep, then rises again before dawn. For people with healthy circulation, that dip helps the body reset. But if you have hypertension, atrial fibrillation, or any form of cardiovascular disease, your system doesn't regulate that rhythm well on its own. That's why your medication matters most at night. It prevents blood pressure spikes and arrhythmias that often occur between 2 a.m. and 6 a.m., the very hours when most strokes happen. According to Hypertension in 2021 and JAMA Cardiology in 2020, missing even a dose can let BP rebound overnight. Extent depends on the drug. Consistency matters more than morning versus bedtime dosing for outcomes. So pick a time you never miss. Without medication, pressure builds, arteries stiffen, and platelets, the cells that cause blood to clot, become hyperactive. In an aging circulatory system, that can be enough to trigger a clot while you sleep. The fix is simple but vital. Take your medication at the same time every night, no exceptions. Use a reminder alarm, a weekly pill organizer, or even a note on your nightstand. If you're unsure whether your medicine is meant for morning or evening, ask your doctor. Some drugs, like beta blockers or ACE inhibitors, work best at night because they stabilize blood pressure during sleep.
8. Sleeping in cold rooms without proper neck support. Many older adults believe that a cold room means better sleep. It feels refreshing, crisp, and helps them drift off faster. But when the temperature drops too low and your neck isn't properly supported, it can quietly strain the blood vessels that feed your brain. Cold air causes vasoconstriction, the tightening of blood vessels, especially in the neck and scalp, where two major arteries, the carotid and vertebral, deliver oxygen to the brain. At the same time, poor pillow support can bend or twist those arteries. The combination of cold-induced narrowing and mechanical compression restricts blood flow even more, particularly in older adults whose vessels are already stiff or narrowed from age. Research from Hypertension 2022 and Surgical Neurology International 2024 shows that cold environments can increase nighttime blood pressure by 10 to 15 millimeters of mercury, while poor neck alignment can reduce vertebral artery flow by up to 25%. Together, these effects make the brain more vulnerable to oxygen drops, especially during the early morning hours when blood pressure naturally surges. The warning signs are subtle: morning dizziness, stiff neck, tingling fingers, or mild headaches that fade after you get up. But over time, these small disruptions can lead to microvascular damage, tiny injuries that accumulate in the brain's blood vessels and raise the risk of stroke or cognitive decline. The fix is simple. Keep your room cool, but not cold. WHO recommends a minimum of 18 degrees Celsius for heart health. The ideal temperature for seniors is around 18 to 20 degrees Celsius, 65 to 68 degrees Fahrenheit. Use a medium firm, contoured pillow that keeps your head and neck aligned with your spine, not angled downward or sharply to the side. Avoid tucking your chin into your chest or curling too tightly under blankets. World Neurosurgery 2024 documented that prolonged neck flexion during sleep can reduce vertebral blood flow and trigger transient ischemic events. Small details matter. The way you support your neck tonight can determine how clearly you think and how strongly you move tomorrow morning. 9. Wearing tight neckwear or jewelry during sleep. Some people go to bed still wearing necklaces, medical alert chains, or even CPAP straps that are too tight. But the neck is the lifeline of your brain. Anything constricting it can quietly obstruct blood flow overnight. When necklaces or straps compress the neck, they restrict the jugular veins that drain blood from the brain. That pressure causes venous congestion, mild swelling, and increased intracranial pressure, which can lead to morning headaches, facial puffiness, or blurred vision. In severe or chronic cases, it can even trigger jugular vein thrombosis. Research in Sleep and Breathing 2022 found that neck compression pressures above 5 mmHg during sleep reduced cerebral blood flow by about 10% in older adults, particularly those with high blood pressure. Fix. Remove all necklaces, scarves, or tight jewelry before bed. If you wear a CPAP mask, check that the straps are snug but not tight. You should easily slide a finger between the band and your skin. Let your neck breathe freely so your brain can too. 10. Sleeping right after a heavy meal or alcohol. The habit that shocked researchers, going to bed right after a heavy meal or an evening drink. It's something millions of older adults do without thinking. A full dinner, a glass of wine, and then straight to bed. It feels comforting, a small reward at the end of the day. But inside your body, that simple routine can quietly raise your stroke risk overnight. After a large meal, especially one high in fat or salt, your body redirects blood away from the brain toward the stomach to digest food. That temporary drop in cerebral circulation may not feel dramatic, but it matters, particularly when your arteries have already stiffened with age. A 2023 Nature Communications study of more than 100,000 adults found that eating within 2 hours of bedtime significantly increased cardiovascular risk, regardless of calories or diet quality. Another crossover trial in the Journal of Clinical Endocrinology and Metabolism 2020 showed that eating dinner at 10 p.m. instead of 6 p.m. impaired overnight fat metabolism and caused higher morning insulin and triglyceride levels, all key drivers of vascular damage. Then comes the alcohol. It acts first as a vasodilator, relaxing blood vessels and lowering pressure, which is why you feel warm and sleepy. But a few hours later, as the alcohol wears off, those same vessels constrict sharply, creating a rebound spike in blood pressure. That swing from low to high is one of the most dangerous triggers for nighttime stroke. Research from Disembody et al., Sleep Health 2020, Alcohol Clin X Research 2021 found that even moderate evening drinking raises nighttime heart rate, lowers vagal tone, and increases morning blood pressure variability. And Harvard Health warns that any regular alcohol use is linked to chronically higher blood pressure, one of the strongest predictors of stroke after 60. Let me tell you about Gerald, a 74-year-old retired farmer from Nebraska. Every night he'd eat dinner at 7, pour a small bourbon at 8, and head to bed by 8:30. One winter morning, his wife found him unresponsive. Doctors discovered a massive ischemic stroke, a clot that had formed overnight. No atrial fibrillation, no skipped medication, no warning. The likely cause? Elevated post-meal triglycerides, rebound vessel constriction from alcohol, and mild dehydration, a perfect storm that silently cut off blood flow to his brain. The fix? Wait at least 2 to 3 hours after your last meal before lying down. If you drink, keep it light, earlier in the evening, and always with water. Avoid salty, greasy, or sugary foods before bed, and never mistake alcohol-induced sleepiness for true rest. This single change, adjusting when and how you eat before bed, could be the most important step you take after 60, because protecting your brain doesn't start in the hospital. It starts at your dinner table. If you've ever woken up dizzy,
Your hand felt weak or your speech slurred for a few seconds and you thought, it's nothing, I'll be fine. Please don't ignore it. That's not aging. That's your brain asking for help. Every small episode like that, even if it fades, means your blood flow was interrupted, even for a moment. The good news is you still have time, because the same body that sent you that warning can also heal if you change how you sleep tonight. One small adjustment at a time, one wiser choice at a time. Protecting your brain doesn't begin in a hospital. It begins in your bedroom before you close your eyes. So let's make it clear. The way you position your head, your neck, and even the air you breathe at night, these are not minor details. They decide how well your brain is nourished, how steady your pressure remains, and how safely you'll wake up tomorrow. Most strokes that strike during sleep are preventable. They don't come from fate, but from years of small, overlooked habits that can be corrected starting tonight. So here's what to do. Elevate your head slightly, support your neck, keep your room comfortably cool, remove any tight jewelry, avoid heavy meals or alcohol, and never skip your medication. Treat sleep as medicine. Every night, your brain fights to restore blood flow, clear toxins, and protect your memory. If this message opened your eyes, hit like, subscribe, and turn on the bell for weekly brain protection tips. And tell us in the comments, what's your usual sleeping position? Because your story might save someone else's life tonight.